and thank you for having me at this Great Jazz Festival event. It's such a pleasure to be able to share some of what I've been doing here back home under the Geo Innovations track. So my name is Kumbula Nicholas Matingo, and I'm a GIS consultant and the national point of contact for Zimbabwe with the Space Generation Advisory Council. I also volunteer with several and various groups towards different causes around the world by applying my skills and abilities in the geospatial technology domain. So today I'm going to be talking about one of my recent innovations, which is a medical sample or a specimen transportation system that implements a GIS workflow for improved healthcare service delivery with a focus on Zimbabwe. Okay, so an effective sample transportation mechanism is a key component in disease diagnosis and monitoring success or failures of outcomes within the healthcare sector. So every time someone visits the doctor, when the doctor is unsure, they usually order some tests for that patient, which is then what determines the course of treatment that you're going to get. So back home, we have what is known as the National Viral Load Teller Plan, which recommends that point of care machines must be placed in most healthcare centers across the nation for quick diagnosis. But unfortunately, these cannot cater for all. Hence, a more efficient and managed and coordinated transportation approach is key and essential for digital health implementations. Okay, so with such, we identified 4 problems that we're currently facing as a nation. So currently we have a parallel system in a single country with the same goal. So the government has their own transportation system, while its partners and other players in the healthcare industry have their own needs and approach. But the end goal is always the same, which is to provide diagnosis for patients. So this results in high resource usage, which is rather unnecessary in a way. And this also results in high costs. And despite these implementations, there's no way to monitor or evaluate the systems, as everything is still manual and paper-based. So now, through the implementation of GIS, we have developed an approach that brings 3 components into account. And these are the harmonization of the medical transportation approach for Zimbabwe, where we are making the efforts from the government together with their partners implement a single but all use case. And we're then introducing the tracking and monitoring of the progress through digital means and applications. So the last and rather most important factor is that we are then introducing location as a key component within all these integration workflows. So how did we do this? Basically, we are implementing a phased approach that begins with the mapping of resources around the nation. So as you can see on the map, we have Zimbabwe there, and we're looking at the infrastructure that is currently existing in each of the healthcare institutions across the country and determining the status of each and every one of these health institutions. Then we design models that take measures into consideration. So for example, some medical facilities only have like 1 motorcycle for transportation, and others do not even have anything. And some have some testing capabilities for diagnosis, and some do not have those testing capabilities. So remember, we do not want to build something which is cost effective in terms of sum of amount, but rather stick to the low budget that is currently available within the nation. So using this, we then developed a geospatial workflow that takes both the physical and geographical aspect of development and implementation. Finally, when all the designing and modeling is done, we then had to implement the software. All logical architecture is currently running on the ArcGIS platform, and is a mixture and combinations of what currently exists on the ArcGIS platform on which we are leveraging. So here's a map which generally shows an overview of these resources which were mapped for the nation. So for this, we implemented the hub and spoke model, in which the spokes are collection centers for health facilities around the country that have no testing capacity or capabilities, while the hubs are facilities with both collection and testing capabilities. We also have reference laboratories that are equipped with specialized testing capabilities around the country. And these are usually the last port of call disease diagnosis in the nation. So the spokes where the collection points are here represented as cluster 1 and cluster 2. When samples are collected, they are first moved to district hubs, and when these district hubs do not have testing capabilities, they are moved up chain to provincial level. In a case for Zimbabwe, we have 10 provinces. So that means there are only 10 of these facilities in the whole nation. When that fails, the last port of call is the reference laboratories. So it's more or less like a food chain, but for the medical sample transportation systems. So here's an overview of the architecture and the workflow for this GIS-based system. It starts off with the input coming from the health facilities, both hubs and spokes, and various data sources. For this project, we used OpenStreetMap data. Once the data enters the system, we have system users and analysts that will be able to see and monitor this through the cloud. And the system automatically generates a timetable for scheduling pickups and drop-offs of samples and results based on a criteria of demand between these facilities. That being done, routes are generated together with estimated time of arrivals for the riders to navigate, and health facilities to know and be able to provide their patients with accurate information on whether on the actual dates when they're actually be receiving their result. So data is transferred to the database to the server, and different users with their roles can work collaboratively for monitoring, status updates, and tracking for the implementation. So now I'll take this point in time to demonstrate to you like a simple workflow of how the system works. So I'm going to stop sharing my screen, and then I'll navigate back to my browser. So just a few seconds. So navigate to my browser, and then I'll reshare my screen again. Okay, so I hope everyone can now see my screen. So this is like the health facilities which are currently available in Zimbabwe. So each health facility has an administrator or I could say like some staff members which are currently in each facility. So what they do now is when a patient needs to be diagnosed or when a patient requires like some medical laboratory like sample to be collected, the health facility goes onto the map and then they select their specific location and then they capture the data for the sample. So they can either use the Survey 123 app like over the mobile application or the desktop application, or they could actually use the web browser depending on their internet connectivity. So for this demonstration, I'm going to use the web browser and open the web browser. So in cases where they do not have internet connection, they could actually use like the offline to the desktop app and then synchronize this whenever they get connected onto the internet. So I'm just gonna wait for that to open just a little bit. Okay, so now that's open. So remember over here, like we clicked a health facility, which we then determined and said, no, we want to like collect samples for this facility. And then it opened this Survey 123 app. So automatically it populates like the facility ID for which we clicked on. And it also auto-populates like the date and time for that facility. And then also like the facility name is already entered into the system. So then we now enter like the specimen identifier, which is just like a unique code for each specimen. So we enter some default data and some patient like record data to identify like the unique patient which is being tested. And then you add like the test type. So for this one, I'm going to be testing for CBC and urinalysis. And then you specify the health hazard level. So the health hazard level is then used for transporting samples because we don't want to mix samples which are rather like transmissive to the air together with samples which are less like explosive. So we need to manage this in a professional medical setup. And then we indicate like the status to say the status is currently ready for transportation to the testing facility. And then we then identify the testing facility to which we're going to be transferring these samples to. So in this case, I'm going to be transferring them to this medical laboratory. Then it automatically populates this map here with the coordinates of this testing center that I've chosen. So there's no need for me to go and click again on the map. It already does that for me. And if there are any instructions that I need to add, I can just add them here. And then I again go and click on submit. So once the records have been submitted and everything has been verified, it's then updated into the database. So over here we have like a tracking dashboard which monitors like these samples to say, okay, so currently we have collected 14 samples, and how many samples are actually ready for collection. And it also provides some status updates for some of the samples which are within the system. To say, okay, how many hazardous samples do we have ranging from level 1 to level 4, and how many, and what's the status of most of the samples. So currently on the dashboard, you can see that we have a map which contains like some of the data which is being visualized here. And then when the sample arrives at the laboratory staff can be able to update each and one of these samples. So remember, like the sample that we actually added like a few seconds ago is the one which is at the top. And if we want to edit that sample, say it's now ready like for collection, we then just click on it. And then once you click on it, then click on edit. And then we can update like the status for that sample. So in a case where the results are ready for collection, just click on the results ready for collection, and then we save that sample. So it then automatically goes back and updates our dashboard. So just give that a little bit some time. This value should be 3. So yeah, I believe that some back-end work like going on. And once like all the samples have been updated, now like the rider is the one which uses like these navigation mechanisms. So to say if the rider wants to navigate to this specific location, it then provides the rider with a route for them to actually navigate. So I could just add in a location. Okay, I think. Okay, so if there's a location, they could actually pick like that specific location. I'm not sure what's happening to my browser, but for the interest of time, I'll go back to my slides. Okay, so automatically it has picked up like my location. If I want to navigate to a facility, and then it can automatically like you just enter in like the address there for it to actually to actually like add in like the facility to which you want to navigate to, and then it automatically also generates like the directions to which you want to navigate. So unfortunately here I placed like a location is outside of Zimbabwe because I just wanted to demonstrate like the routing facility. So like the routing functionality is embedded like within the application. So I'll go back to my slide and continue with my presentation. Okay. Okay. So that being said, as you have seen from the mini demonstration, we took a glimpse of the routing network, one of the provinces in Zimbabwe, which is Mashonaland province, as you can see on the map. So this, as you can see here, we have each and every hub and spoke interlinked to the road network, while some have 2 or more alternative routes for navigation, and unfortunately others only have one routing path. These are optimum routes stored within the system, which most of the drivers will be using depending on the road traffic conditions. So here's a depiction of how the integrated medical transportation system was before and is now after the modeling and the workflows for implementation. So before the integrated approach, each network had to traverse through all the facilities indicated with the larger road filled with many stops. Approximately, this would take at least 18 hours to cover for these areas, with which increases like the turnaround time to deliver results back to the patient. But with the implementation of the integration through GIS, resources can be combined from government organizations, partners, organizations, and private sector players. So here are some of the products of which some of the products of this innovation. As you have seen from the demo, we saw the dashboard, which is used for tracking and monitoring, while the laboratory data management platform used to update records at each health facility point. Then we have the IMSTS driver toolkit, which is a mobile application that we're currently developing, moving away from the web system that is used by the driver for navigation, notifications, and updates like during these operations. We're currently working to allow this application to use the most minimal network bandwidth, as some areas in the nation do not have a good network coverage. So by implementing this integrated approach in Zimbabwe, we've anticipated and focused for the following. we are looking forward to reducing like the cost of all operations that require the transportation of samples from one facility to the other, and easy and integrated monitoring and management of these workflows through digitally accessible and viable means. We also look forward to having a coordinated and collaborative approach in the healthcare sector, which leads a pathway to the digital implementation for Zimbabwe. By digitizing, we foresee further innovations leveraging on the data generated for the system. And for the patients, this will reduce the turnaround time required to generate and provide feedback and results. Lastly, not to mention the transparency and efficiency that this brings to the government and the health and the health process. So what does the future look like for this location-centered and focused digital health system? We already have our COVID-19 hub for Zimbabwe, which was used in the efforts to fight the pandemic. And now that we're looking forward to turning this into a pandemic response system, we also anticipate integration of this integrated medical sample transportation system module. And we're also looking forward to adding more functionality as we are using the rapid throwaway prototyping method, which allows us to use the user experiences and feedback to further develop and improve these systems. So I think that was my whole presentation on the integrated medical sample transportation system. And yeah, thank you all for listening and for paying attention.